Okay, good morning, my friends, wherever you're watching us from. It is a beautiful Sunday morning, and I welcome you to yet another episode. First of all, I want to thank everyone that watches, follows, and subscribes to this channel. As we talk, we have close to 2,000 subscribers. So if you're watching and this is your very first time, I kindly ask you to subscribe. And a special way to people that take time to watch our videos. We've so far have made about close to 90,000 viewers that actually watch more than 30 minutes of these videos every single Sunday morning. My name is Mr. Selfcare, and I welcome you again. It's a beautiful Sunday, and we are going to talk about something very important, something very special, a health condition that lives with most of us, most of our families in Uganda and Africa at large. We are going to talk about high blood pressure this morning. We are going to understand how we take care of hypertensive patients or people with high blood pressure at home. Me and you know that when these patients go to hospital, the hospitals or health facilities try to stabilize these pressures or these high blood pressure. But when these people go home, due to certain things or due to failure to comply with the medical advice, we find ourselves with relatives whose blood pressures again shoot or go high again. So today I found it very important, or I found it imperative to involve an expert here that deals with these patients, or what we call OPD, or outpatient department at Lubaga Hospital, to take us through how we are supposed to take care, or how we are supposed to handle patients or loved ones with high blood pressure. We are going to talk about nutrition. We are going to talk about measuring blood pressure at home. We are going to talk about signs that you see and take back and seek medical advice. We are going to discuss the beauty or the importance of sleeping to hypertensive patients. We're also going to understand the importance of exercise and why we need to have these patients do some little exercise while at home in trying to help them manage high blood pressure. World over, millions of people live with high blood pressure and live for as many years as they wish to live. But in Uganda, we are still struggling with high blood pressure because of some simple mistakes that we make while home that does not keep our blood pressure in check or stable. It is not a death penalty for one to be diagnosed with high blood pressure, but it will take you discipline to stay longer if you have high blood pressure. And most of the time, these simple ways, simple and smart ways must be done at home. So this episode of video is for any family in Uganda that has an hypertensive patient at home. This video goes out to nurses that are doing home care for patients with high hypertension or high blood pressure. This video goes out to that family in Uganda whose mom, whose dad is living with high blood pressure. What are some of the simple ways we can take care of this patient to make sure they live longer and to make sure they don't keep going back to hospital? And today with me in the studio is Madame Solome Nakato Ole from Lubaga OPD department, and specifically the department that deals with patients that have high blood pressure and diabetes. But today we are going to be talking about high blood pressure. Solome, can you please introduce yourself to our viewers, and we shall start from there.
Okay. Thank you so much, Mr. Chimbawa. Our viewers, good morning to you all. and those in other different parts of the world. Good evening to you. My name is Solomon Nakato. I'm a nurse and I work with Uraga Hospital.
Okay. Solomon, we are happy to have you here. This is Mr. Selfcare Live, and we are here every Sunday morning to talk about different healthcare problems and how we can help our people live a better life. First of all, I want to thank you for accepting to be with us this morning on short notice.
Thank you.
And thank you so much for serving the people of Uganda through Rubaga Hospital. And people at Rubaga, we send you our appreciation as well. Thank you so much for employing Musao Solome. So let us start with first things first, Musao Solome.
Yes,
What's high
please.
blood pressure in simple terms?
In simple terms. Thank you so much, Mr. Chimboa. High blood pressure, the simple way I can explain it to you is that pressure that comes in when the heart is pumping blood and the walls of your blood arteries, your blood vessels. So this pressure is exerted on your blood vessels. And when it is consistently high, it brings high blood pressure.
Okay. So in other words, when the heart is pumping blood to the rest of our body, and the pressure by which this blood is leaving the heart to the walls of these different blood vessels is high, consistently high, that someone is considered hypertensive, or we say someone has high blood pressure.
Exactly.
How do we know that someone has high blood pressure?
Okay, thank you so much. Yeah, we grade high blood pressure in different categories. I will start with the first category. When do we know that someone has high blood pressure? We have what we call type 1 high blood pressure or hypertension. Okay, I'll first tell you what the normal value is before we go to the abnormal value. Is it okay?
Please.
Yes, please. So the normal blood value or blood range, blood pressure range, it is between 110 because we have the upper value and the lower value. So the upper value is 110 to 129. That is the upper value, what we call the systolic pressure. Then we have the lower value, what we call the diastolic pressure. So the lower value ranges between 60 to 89. We regard it to be normal when it is between that. And when it is below that, it is still abnormal. That is low blood pressure. According to today's discussion, you've told me we are going to talk about high blood pressure.
Okay. So let me cut you short, Musao Solome. So you said when we tell high blood pressure by looking at pressure readings, right?
Yes, please.
So to viewers that have gone to hospitals, you'll not see that we have, when normally we go for these pressure checkups, they are going to give you two values. One value is upper and one value is lower. And Musao Solomon is telling us that the upper value is what we call a systolic value and the lower value is what we call a diastolic value. And she's giving us values here, telling us that values between 110 and 100. Is that 129 or 139?
29.
So 129 is normal for upper values, and then 60 to 89 is normal for lower values, or what she has called diastolic pressure. So, Musao Solomon, what's the difference between systolic volume or the upper volume and lower volume?
The lower volume. So
Yes.
the upper volume means this is when the heart, our heart, when our heart is pumping out blood,
Yes.
it contracts.
Yes.
So when it contracts, that is the upper value.
Yes.
And when it is contracting, that is when it is pushing blood to the lungs. You get it? So the
Okay.
lower value is when that heart is at rest. It
Okay.
pushes blood, then it rests.
Okay.
That is the lower value.
So one value, the upper one, is when the system is contracting and one to push out blood, and then the other is when it is taking in blood.
No, when it is at rest.
When it is at rest.
Exactly.
Okay. So how do we measure blood pressure at home?
How do we
How do we
measure blood
measure this blood pressure at home?
at home?
I have my
Thank
father at home or mother, and I'm taking care of them. How do we measure? These days, most of the time, we are having what we call automatic or
digital.
digital monitors or BP machines. So how do we measure? Where do we insert, and what do we do after seeing those values that we get?
Okay, thank you so much. How do we measure? That's a very beautiful question. Often a time, people buy those machines, but they don't know how to use those machines. I appreciate that so much. So, how do we measure? If you have someone, your mother, your father at home, when do you measure blood pressure? Always, I recommend and I advise people to to have a specific period when to take blood pressure. If you are taking it at 6 a.m., let it consistently let it be 6 a.m. If it's at 3, let it be 3. Then secondly, when we are taking this blood pressure still, uh, you prepare that person. You prepare that person 5 minutes before this person should be at rest. Give them 5 minutes to rest in one position. And when that person is resting before taking, the hand, because we are using the upper arms,
Yes.
most of the times we are using the upper arms.
Yes.
The upper arm should be resting either on bed or table and at the level of our heart, sorry. So our
Okay.
heart is on the left side. So your arm should be resting and it's at the level of or the level of your heart.
Yes.
Yes. Then secondly, Mr. Chimboa, when you
Yes.
are taking this blood pressure, always we use a machine, be it a monitor or a BP machine. It should be of the reasonable size. When we are tying it, it should not be so tight, neither so loose. It gives different values. When it is very tight, it deviates. And when it is very loose, still, it will give different values. So I advise people when you're taking the blood pressure, always consider the size of the person and get a comfortable cuff for this person. Then still, we always advise we use a bare arm. You might have a jacket on top, a sweater, but we always advise to use a bare arm. And the end, we have to record these readings. I advise people at home buy a textbook, an exercise book, a simple exercise book. You note the date and the time you've taken the blood pressure. It's for monitoring and tracking. When you go back to your physician, to your doctor, this is evidence that I've been taking and this is how I've been monitoring myself. Thank you so
Okay.
much.
So you've talked about, I've picked a few important aspects in your last explanation. Number one, you said you should pick a constant time every day when you do your blood checkups. For example, if you decide to go at 8 a.m. every morning, you should do that at 8 a.m. every morning. Number two, you said we should have a book where we record these pressures for these people, because that's the only way we can keep tracking. Mr. Solome, are there some people that have high blood pressure, but they are not hypertensive patients whose pressure just goes up like once in a while, and they are not? How do we confirm that this one is hypertensive and this one is not hypertensive? Is it that
Okay.
each time I measure someone and they have high blood pressure, then they are blood pressure, or there are sometimes when we measure high blood pressure and it's just high for some reasons?
Yeah, thank you so much for that question. We confirm someone to be having high blood pressure after observing that person for a period of 3 months.
Okay.
Though there are some readings that may not need us to wait for the 3 months period. For example, we have what we call, okay, we grade our blood pressure in type 1, type 2, and type 3.
Mm,
So if someone comes on day one with high blood pressure of 180
mm,
over one, you remember when we talked about the systolic and diastolic pressure, the
mm,
upper value and the lower value. So if someone comes with that high blood pressure of 180 over
mm,
120, immediate action should be taken.
mm,
That patient is put on antihypertensives. Whereas if someone comes with a blood pressure of 140
mm,
over 100,
mm,
we might give it a benefit of doubt, and we observe for a week before
mm,
we start antihypertensives. Reason being, there are some other precipitating factors. For example, you've lost a loved one
mm,
and your blood pressure shoots high.
mm,
It may not be permanent,
mm.
just temporary, but after observing, it can go down.
Okay. So some people have high blood pressure, but they are not severe blood pressure. They are not hypertensive. The pressure just caused by some external emotional or physical challenge that has caused their pressures to go high.
Exactly.
So you're also confirming that we are supposed to confirm pressure like after 3 months
Yes,
after
please.
constant, but also confirming that sometimes people come with high blood pressure, and depending on their reading, you start them on medication, not waiting for 3 months.
Yes,
Okay,
please.
that somehow answers the first question of how do we tell someone has high blood pressure. Musao Solome, so many times you we've been in hospitals. Uh, our parents come to hospital. The hospitals handle this blood pressure, but when they go back home, the pressures shoot up again. In a hospital, the pressures are managed. When they go back home, the pressure is shoot home. What could be the cause of this?
Okay, that is caused by very many things. Thank you for that good insight.
Yes,
First, in the hospital, you find that this person is under medication
yes.
and observation by the medical team.
Mm,
Then, when you go home, there are a lot of things that might lead to high blood pressure. First, the lifestyle we live, the
okay.
lifestyle, what we eat at home.
Yes.
Then, the monitoring of the medication we take. Are you
Mm,
taking your medication in the right way?
mm,
So in the hospital, it so happens that the medical team administers treatment. But
yes.
when you're at home, the chances are high that you forget, or else your attendants at home forget to give you medication. So in so doing, you find the pressures go high at home compared to when we are in the hospital.
Okay. Okay. So number one reason why some we manage pressures in hospital but not home. Number one is medication, like failure to give people medication on time. So Musao Solomon, how then should we look after these people when they leave hospital and come home? Because that is our topic of discussion. Because so many people are telling us, we are telling, oh, Mr. Self-Care, it seems like there are some medicine that these people give our patients when they're in hospital. When do we go home? Immediately before even you get the following day, like after getting out of hospital, the pressure is shoot. How can I take care of that muzee of mine, that papa of mine, that mother of mine, who is being diagnosed with hypertension at home?
Okay,
And
thank you so much.
you can start with diet. How do we? What should they eat? What should they not eat?
Okay, before I go to the diet part of
Yes,
it
yes,
all comes back to us, the medical workers.
yes.
When we are discharging these people out of the hospital, these are things we are supposed to teach them.
Mm,
Someone going back to Chiboga,
mm,
me as a nurse, I'm supposed to tell this patient the routine things that he's supposed to do. That's why they are giving such compliments that when this patient was bedridden in the hospital, the blood pressure was well controlled.
mm,
But when it goes home, it is not, it deviates.
mm,
Reason being, this patient was not told what to do. All
mm,
the attendants were not told what to do when at home.
mm,
So you asked me to talk about the diet, what to take when you
mm,
go home. Okay. So there are some foods that a patient with high blood pressure is prohibited from taking.
mm,
And there are some foods that we advise this patient to take occasionally if this patient is able to access them.
mm,
So, some of the kind of foods that we advise these patients to take
mm.
are the vegetables and fruits.
Okay.
Yes, we advise them to take vegetables and fruits. Then we advise these patients to take low salt diet. Low
Okay.
salt diet, okay.
Yes, please.
Okay, low salt diet means we should limit the amount of salt we are putting in our foods,
Mm,
most especially low salt, the uncooked salt.
mm,
I'm going to speak this in Uganda. There are instances when we are, for example, you're making avocado and you
mm,
bring salt, no leto munyo no mansako.
mm,
Yes, you're preparing salads, no leto munyo no mansako. That's what we call low salt. And
mm,
most especially to the elderly,
mm,
often omunyo tegwanoze n'ayongeramu omunyo ogwo ogutali cooked.
mm,
So we always tell these patients, please let us make it a point that we stop taking low salt. Then the other thing we always talk about concerning diet is fatty foods.
mm,
Yes. So we always tell them to take milk, but
mm.
milk olububi, omanyi olububi?
Um,
Olububi.
yes.
Yes, if you can get the pasteurized milk, that
Mm,
is better. But then at home in the villages, we are unable to identify whether this is pasteurized or non-pasteurized. So when
mm,
we cook milk, these patients tubagamba
mm,
olububi olwo n'aluggyako n'aluwa abaana abato ye n'anywa amata agataliimu lububi.
mm,
If you are to buy meat, buy lean meat, ennyama
mm.
etalina masavu gye baba balina okulya. And we
Okay.
always advise them to take meat at least once in a week if
Mm,
oba tosobola kyebeera,
mm.
not more often. Yes.
Okay. So you've said raw salt omunyu omubisi is dangerous or bad for people abalina high blood pressure. You've also stressed meat. So, and then you said we should not eat those ones because bigenda kuongera, or they may worsen the situation. You've also said we should have a lot of all grain foods, and then also fruits and juice. Um, okay. So there are some exercises that these people are supposed to do while home. Are there
Yes.
some exercises that these people are supposed to do while home?
Thank you so much, Mr. Chimboa.
Mm,
I'll talk about exercises.
mm,
And often the time we've misled people with exercises. So when you tell it is my obligation as a nurse, when
yes.
I'm discharging this patient, when I'm health educating these patients, to tell them what kind of exercises they are supposed to do.
Mm,
So if this patient is hypertensive, we don't expect this patient to go to gym,
okay.
because the kind of exercises that are done in the gym are vigorous exercises.
Yes.
I don't expect this patient to go on a very big hill to run up and down. Okay?
Yes. Mm,
So we are supposed to tell these people that kind of exercise are just simple walking exercises at home.
mm,
If it's an elderly patient, ask, can you move around your house? And
mm,
yes, I can. Every morning and evening, 3 to 2 times.
mm,
So you rotate around your house 3 to 4 times. Okay? Can you move around your village? Yes, we
mm,
can. So every evening, the husband and the wife, they escort each other.
mm,
They move around the village, they come back. The jogging exercise, simple exercises.
mm.
Yes, please.
So, when we are dealing with hypertensive patients, exercises are okay, but they
Yes.
should be regulated and minimal. So, this actually goes to we've had a lot of homicides or people dying at home, especially in the rich suburbs or where people have money. And finding out is that this one man or woman, hypertensive, they went and started either doing carrying heavy loads, and every what before you know it, their heart stops pumping, or I mean, they have issues with their heart. So this is a reminder that yes, exercise is good for everybody. But if you're hypertensive, remember the health condition that you're having has something to do with your heart. And when you're pumping, when you go to exercise and do heavy load exercises, you're adding more work for already a compromised cardiovascular system, or already a compromised heart. So it also goes back to our gym instructors. Mr. Chimayo, Stephen, is a professional gym instructor somewhere in Luzira. Mr. Chimayo, you should teach your friends that not everyone that comes to gym should be put straight to heavy loads. We should actually have like a screening tool to make sure to check out which of our clients um, actually are able to carry on or are able to endure the heavy exercises in gyms. Because if someone is hypertensive and maybe their readings are above 180, the systolic, then you put them on heavy exercises, we may have emergence cardiovascular issues. So yes, exercises are fine, but we should regulate which type of exercises we are giving these people. So Solomon, you talked about medication, and I have a question here. Someone asking which medication is better than the other when it comes to high blood pressure, because they see some people taking small pills, others are taking more than one pill, others are taking multiple colored pills, others are taking bigger tablets. what would be your take on medication for hypertensive? Do we have to take the same drugs? Does it depend on the measurements that you've gotten from your machine? Does it depend on color, that some people are white, others are black? Is it a tribal thing? Talk about medication as we are talking about taking care of hypertensive patients at our homes.
Okay, thank you for that question. Medication, it depends on your pressure readings. Medication depends on what might have caused high blood pressure. So
Okay.
various people have different ways, okay, different causes precipitating factor to this high blood pressure. So this medication is given after further investigations that this might have caused high blood pressure. Then you're initiated on the medication. It may not be the same. You find that the cause of high blood pressure in Solome, it is due to cholesterol. Whereas the cause of high blood pressure in Annette, it is due to enlarged heart. Okay?
Yeah.
Or moving plaque in the blood vessels, constricted blood vessels. So these people are given different kinds of medication. And I always advise patients, please you go and seek counseling from the health center, from a trained person. Not everyone should initiate you on these medications. And this is a chronic illness. So chronic illness means you're going to carry it on. So this business, because you find that my neighbor is taking black pills. The other is taking white pills and they are working for him. So I should switch the white pills because they help sand sore. No, our bodies react differently. So you go to your doctor, your physician, your nurse, ask for assistance, ask for measurements, ask for investigations to be carried out so that you're initiated. And in any way you want to switch, please go back to that same person. Yes, please.
So, in other words, you're telling us that we could have the same readings. Both of us are 140, maybe over 80 something. Both of us from same hospital, same color, same what. Then doctor gives me white, and then for you gives me purple pills. And they both
Yes.
work different for both of us. In other
Mm.
words, before, to anyone watching out there, before you switch your drugs, before you change, because I can come to visit you and then we both are hypertensive, and then you see me taking other pills and I tell you, oh, I feel fine. And then you're like, oh, Richard said they feel fine after taking the blue pills. No.
Mr. Chiboa, can
Yes,
I
please.
supplement something still?
Please,
You
please.
find out that it's a husband and a wife at home.
Yes.
So the husband goes to the pharmacy, buys medication, they share with the wife.
Oh.
But because this wife has ever gone to a hospital and they found out the pressure was quite high, didn't go for further management, further investigations. So we'll share the same pills with the husband, which is not right. These are, yes, you're staying in the same house, but the cause of the blood pressure may not be the same. I submit.
Okay. So that means that friends that are watching, again, I happened to have a discussion with one physician about actually diabetes and high blood pressure. And I remember him telling me that these are disciplinary diseases. If you're disciplined, you're going to live longer. If
You're
you're a
right.
person that is indisciplined, you're going to have issues, simply because you must carefully listen to the instruction that I'm going to give you. If they tell you don't eat this, do not eat that. If they tell you take this at this time, please do not miss the instructions, because this is a disciplinary issue. If they tell you do not overconsume raw salt, do not say, some people say, I have one of my great sisters. I won't mention the name. she knows herself. She has one disease naye bamugana okulya ennyama, but one of time agamba naye najidde ku mbaga yokka. And each time she goes for a wedding, akomawo enkeera alina okudduka mu ddwaliro. So we must be disciplined enough when it comes to pressure. Otherwise, you're going to lose your precious life because you're missing out something. A small thing like addition of raw salt could trigger a lot of chemical reaction in the sodium chloride that is in that salt and your heart, and makes a person that was talking get cardiovascular issues, or even it may become an emergency. So muli kumbaga obadde olya bulungi n'ogatta omunnyo mu mmere no causing emergency. Oyinza okuba ate gwe obadde omugole omwami. So let us listen to instructions. Then secondary, medication. If bagambye so Solomon, talk about the time of medication. Like, when are we supposed to take drugs? I want you to throw some light on obudde abantu bamiriramu eddagala. Obudde abantu bamiriramu eddagala. Because it is a challenge in Uganda. Omuntu bagamba eddagala ojalimira emirundi esatu. Kakati emirundi esatu, the first day nolimira ku makya, ku ssaawa 6 n'ogenda okwebaka. Ogwokubiri n'okeera n'ogenda mu nnimiro. You go to the garden in the morning, you forget. Then when you come back at midday, you remember. So you say, I'll take the morning pill, and then the one I was supposed to take now, so you take 2, and then 1 at night. Then tomorrow you go for the wedding, and you totally forget. You remember at night, then you take the 3 of them at the same time. Talk about the time. Prescription, the dosages versus time at which we take these drugs. How dangerous is that? Kubanga nze mba mize empeke zange 3 nga mwazimpa naye nzimiza omulundi gumu. Basawo kiina oliyanga n'ogamba lyonna ligenda mu lubuto. Can you talk about that?
Thank you. First, the duration of the medication depends on the prescriber. So if the prescriber has told you 1 times 3, always ask the prescribers. I admit that tulina okunnyonnyola abantu bano kitegeeza ki 1 times 3. Ojja mugamba 1 times 3 empegamire emu emirundi 3 olunaku. Olunaku, most people think olunaku luva ku makya ssaawa emu paka we yeebaka. But olunaku kitegeeza 24 hours. Okuva ku makya ssaawa emu until the next day ssaawa 12. Then you make a day. And another thing, when tuba tuwa abalwadde bano eddagala, we always ask them, what is your convenient time? Bwe tusandikira, olya emmere ssaawa mmeka, ekyeggulo okirya ssaawa mmeka, nti nkirya ssaawa 3. Okay. This one should, if it is once a day, it should be taken after meal. Tujja mugamba ojja gimiranga ng'ogenda kwebaka. Then ekirala, waliwo eddagala eribimirwa nga it should be taken when this patient is going to rest. There are those kind of drugs. Then waliwo eddala nga lijja kwetaaga immediately when you take it, you need to exercise your body. Like during day, we expect you to be moving, you're not sleeping. And those pills should be taken during day. So kindly remind me of the last question you asked.
No, it was about timing. Is it okay if I miss my morning medication and midday, then I remember at night? Can I take 3 of them at once if I forgot to take 1 in the morning and 1 at during the day?
No, that is not right. If this arrangement, for example, they've told you 1 times 3, n'ogamba ogenze mu nnimiro ate okomyewo, kuba duration eddagala lino mwe lirina okukolebwa eba ebaliddwa. Okitegeera. So eno gap gy'olekawo nga tonnaba kumira ddagala eryo ereeta effect ku mubiri gwo. Tejja kusavinga purpose eri gye twagala. This medication is given to reduce high blood pressure. So you're giving it that allowance from the time you've taken it and the time you're supposed to repeat the next dose. So I advise people, if you're told the time you're supposed to take the medication, let us abide by that. And I will not crucify someone who forgets. And immediately when you remember that I've not taken that pill, please take it. Don't wait until the next day. If I told you to take it at 10 a.m. and you remember at midday, please take that pill. Don't wait for 10 a.m. the next day. But it should not be a routine that whenever I forget, I come and take it like recklessly. You take it anyhow. No, we shall not reach that target of our medication. Have I answered you right?
Yeah, I believe you've answered us right. So in other words, abasawo baba tuwa eddagala lino to people listening out, when our healthcare workers give us these drugs, their target is to make sure there is a concentration of this drug in our blood all the time. Baba n'obungi obw'omuwendo gw'eddagala gwe baagala okubeera mu musaayi gwaffe all the time. That's why they calculate out and they say you should take this drug every 6 hours to make sure every 6 hours your blood concentration has a given amount of a certain chemical compound that is found in that blood. Now, when you miss out on that drug at that particular time, your blood is going to lose that concentration. And so the doctors may and you may not have the intended results. And that's why sometimes we could be having the same problem, hypertensive problem, and reading at start, me and my wife, and we're both taking drugs. But given the different discipline that for her, she takes the drug every day, me, I take when I remember, after certain, say maybe 5 years, my pressure is worsening while hers is controlled. Because I've also been to hospitals where they say, you have high blood pressure, but it is controlled high blood pressure. In fact, one guy said it's high, but now normal and now stable. It really comes back to the discipline that we have when we are having this medication. So if you're having an hypertensive patient at home, I would advise that you even have alarm clock, or you have like
Reminders.
something to remind you. One thing that I've learned with I have a very careful, a very I stay with someone that is very so attentive to these medications, and there is something I've learned, that there is something actually they buy from pharmacies that has number of days. It has Monday. It has Monday. It's like it has 14 days. So what it does, it puts all the medication in that. He puts Monday, Tuesday, Wednesday, like for 14 days. And then when it's done, he puts another 14 days. In this, he doesn't forget to take every day. So I really want to call out to anyone that is taking care of a hypertensive patient that you need to have something to remind you. Bwe mubanga mulina busoosi waka buno obusoosi obutukula, you may have 7 busoses noteekako lino lya Monday, Lwakubiri, Lwakusatu, Lwakuna for 7 days and cover them well, such that on Monday you can clearly tell, my patient took the drugs. On Tuesday, my patient took the drugs. On Wednesday, my patient took the drugs. Because when it comes to hypertension, it is totally about your discipline. If you forget to take the drugs, you're going to drive in late night hours to hospitals. Because now the pressure is continuously increasing even with you taking this medication. So the discipline may be the difference between you and the other patients that are suffering from the same disease. Musao Solome, let us talk about herbs, local herbs. In one of my DM, this one comes from one of my friends in Masaka. She says, I have my mother I have my mother, who is actually a former police officer, but she has, she continuously mixes eddagala lya gyemulago with a certain herbal drug on a kadomola. How dangerous is this, and how is it a challenge to us people that are taking care of patients at home, hypertensive patients at home?
Okay.
What would be your take on that? Maybe it is not a vague question because you don't know what drug is in Kadomola, but generally, how do you talk to your patients about local herbs after you giving them, may say, hypertensive drugs, then they go home, they also have a Kadomola that has herbal medicine?
Okay. Thank you so much to ask such kind of a question, because we've seen this several times. I wouldn't say that the herbal medication doesn't work, but I don't have correct evidence over that it works. So I would always advise my patients, if you're taking herbal medication, don't take it alongside the prescribed medicine from a health center. Yes, if you're taking herbal medication, take herbal alone. If you're taking prescribed medication from a health center, take the prescribed pills alone. Reason being, first, we don't know the ingredients, the constitutions in the herbal medication. So the chances are high that this medication is going to interact with the pills that have been prescribed for you. You get it? So I wouldn't advise this person to take the herbal medicine concurrently with a prescribed medicine. Then another thing with the herbal medication, we don't have doses. So always they give you kadombola, oja kunywako kumacha, no regular. But we don't have the right the right doses of how much you should take. And the problem with that, the complication is liver. We are going to damage our livers, our kidneys. So I always advise my people, things concerning herbal medication, we should be very conscious with it. It should be well noted. I'm taking a spoon a day or 2 spoons a day when you are taking the herbal medication. And there are some instances that someone is pregnant. You're given herbal medication, you are hypertensive, but this herbal medication is not fit for the newborn. Because we have those pregnant mothers, they're hypertensives. We have other classes of medicine we give them. But the person giving you medication will not consider that you have someone inside. You have a newborn inside. And the long run, it is going to bring an effect to the newborn baby.
Okay. So I thank you so much. We shall have a short break for less than a minute, and then when we come back, Mr. Solomon is going to talk about stress, sleep, and the role of social support at home. Again, I'm not here to say herbal medicines are bad. No. But I'm here to say to our friends out there that are selling the herbal medicine, please involve the necessary authorities, National Drug Authority, the Pharmaceutical Council of Uganda, to make sure we can come to term which herbs treat what. Normally, when we come here to talk about medicine, people say, hey, after all the drugs are made out of these trees. Yes. But we know everything has side effects. Now, the most dangerous things we have with these natural herbs is that we don't know what side effect which tree has on a human being. So in that we continuously pack our liver that does the that does the breakdown of these plants, we burden it. Already the heart is having complications, so now we burden the liver with natural herbs. Again, don't quote me wrong. I don't say they don't work, but I'm saying we should have the right dosages. If you think your drug is working out well, take it to National Drug Authority, just like we had the Covidex. He took it, it went through the right processes, it's now prescribed. The dangerous thing is when you go to your home, you use dirty water, you boil out just any plant, then you're stealing from the poor. I lost a friend of mine in 2021 who was working with one of the radio stations in Uganda. Diagnosed with high blood pressure, you met him in Ikamocha, you confused him, you sold off this, whatever. He died of natural poison because you poison his liver with lots of chlorine concentrations. So to any hypertensive patient out there, before you take that herbal medicine, consult your doctor. Some of these herbs you want to take, they work in the opposite way to the drugs that you're given. Some of them go out and block the sites where this important drug is supposed to have an effect, which we call antagonistic effect. I've lost patients who, after prescribing them hypertensive drugs, they went and mixed them with herbs, local herbs. And on doing their post-mortem, they died of natural poison caused in the liver. Just a few days back, I had, I think this week alone, I've had about 3 people who called me to talk to their parents who had persistently refused to get off these natural herbs. Some of them even, you find someone has a 10-liter jerrycan of natural herbs whose name even they don't know. These people that sell these herbs, they get a clean jerrycan, they put in the thing, they don't put any writing, they sell you. Some of them you find them in buses that are going to Masaka. Some of them you find them in buses that are going to Guru. Some of these buses are moving at night. So someone you don't know sells you drugs that whose name you don't know, and you start taking it religiously every day. Before you know it, a person who had issues with their heart and blood vessels, now they tell you your liver is becoming fatty. They tell you your liver is starting to weaken. When we come out here and tell you, abo bali westernized. No, we are not saying the herbs are bad. We are saying come out in the light and tell and let us know how they function, such that we happily prescribe them. Because naffe twagala eddagala eriwonya abantu baffe. But we are not going to come here and sit while you're busy killing millions of people by saying them quack herbal medicine. When it comes to hypertension or high blood pressure, it is total about discipline. So mama wangali eyo, tata wangali eyo, to my dad there, to my father, to uncles and everyone listening, do not mix Western medicine with natural herbs. Remember, our episode today is brought to you by Immotors Uganda. They are importers of brand new and used cars in Uganda. If you are interested in having a new ride, please go to Immotors. They are found in Banda, Uganda, and the contacts are just below your screen. Again, also, if you're a team that needs some leadership sessions, please consult Mr. Busani, Mr. Busani Ngwenya, under the Makohelo Leadership Academy. They will be able to, Leadership Center, they will provide you an opportunity to develop your leadership skills through executive leadership coaching and mentorship. They also offer one-on-one group sessions that can be offered via Zoom or virtually. Busani is well known in the whole of Africa for mentoring leaders. For people that go to Watoto Church, you very well know him. He served in Watoto Church for about 8 years. He's one person that has helped some of us become who we are today. So you're having issues with leading people, with people following you. Remember, you're not a leader if no one is following you. Again, Edisa Foundation are other partners that walk this journey with us every single Sunday morning. Edisa Foundation is a registered community-based organization located in Kayanja, Namataba Town, Mukono District. They provide care for children with the resources that these children may be needing to afford a life. Some of them are scholastic materials, some of them are sanitary wear pads for young girls, some of them are other things like shoes, clothes that may help to sustain these children in school. So if you're there, kind-hearted, you want to give out donation, or you're looking for a group to help out, please contact Edisa Foundation. I'm telling you, your money will be put to good use. The other partners are Guardian Angel. Guardian Angel Nursery School is located in Ibaka, Wakiso. This is a nursery school that offers good quality education. So if you're a parent around Wakiso, Kachiri, Baka, Namusera, please, you can take your child to Guardian Angel Nursery School and you won't regret. You can contact the school administration on the contacts below the screen, and then they will be able to help out your child. Lastly, Momo's Boutique. Momo's Boutique, these are located in Machindi, opposite H&H restaurant. These deal in men's wear. If you're a man that is unsure of what to put on, please go to Momo's Boutique and all your needs will be sorted. Momo's Boutique can deliver things to your home, can do home delivery in case you contacted them in time. And so, if you're having an occasion from weddings to casual parties to beach wears, please contact Momo's Closet in Makinde. They will be able to sort you out. And lastly, Cham International School. Cham International School is located in Muyenga, Bukasa Road. This is a school for today and for the future. They offer an international curriculum, ACE curriculum, that is Accelerated Christian Education. This is the international curriculum based on the Bible. So, if you're having a child that is around Kansanga, Muyenga, Machindi, or Kampala, please contact Cham International School. They will be able to offer the ACE curriculum to your child. They also have a boarding section now, and they say they are raising the next generation of God-fearing leaders with ACE curriculum. So back to our topic of the day. Today we are handling a very sensitive matter, that is taking care of our loved ones with who are hypertensive or with high blood pressure, oba kye tuyita omulwadde abalina pressure at home. How do we take care of these people at home? Before we went into this break, our guest today, South Solomon, all the way from Lubaga Hospital, clearly explained how we measure this blood pressure. She looked at the diet. We discussed a lot on medication and the importance of timely medication to our patients. We've looked at important aspects like exercise, why some exercises may not be so fit for hypertensives, and why, even if some are not fit, they need to do exercise on a regular basis. So we are going to continue with another aspect, that is the importance of social support. How is it important for us to create a support system around these patients that are hypertensive while we are taking good care of them? Why is it not good that we isolate these patients? So Solomon, you're welcome. You're welcome, and I hope you enjoyed the break. So why is it important for us to socially support the hypertensive patients at home?
Yeah, thank you so much, Mr. Chimbo. It is so important that we support these patients at home. This is chronic care. This is someone may not be elderly, a young person like me. You've been diagnosed with hypertension, and you're going to take these pills probably for the rest of your life. Psychologically, you need support. You are not prepared for this. but then you're told that you're going to take these pills for the rest of your life. Then secondly, financially, it is constraining that in most cases, these patients are getting medication from private facilities. Here in Uganda, private facilities offer medication at a cost. So the burden, financial burden is going to implicate on this patient should be dealt with. That's why they need support. Then the lifestyle. If this patient has been diagnosed with hypertension, has been a young man who enjoys going to gym, who enjoys football so much, and has been diagnosed with hypertension, you must cancel this patient. Need support. Need need someone to talk to. What am I going to do if I've been going to gym? So what other thing am I going to do instead of me going for gym for my leisure? Because some people go for gym for leisure. You get it. Then about the nutrition, as we talked about, these are patients who need support that you always we need to talk to them concerning their nutrition. Is an elderly person, you know, most of our judges like meat so much. And now themselves telling this person, ennyama tolya ya masavu, amata tonywa lububi, sukaali kendeeza sukaali. For the rest of her life, she was not taking sugar, teyalina ssente. Aweeredde abaana be bamaze okusoma bamuleetera sukaali ewaka. Then musawo amugamba tonywa sukaali.
Wow.
That is how stressing it is. She did have money, talina ssente zigula sukaali aweerera abaana. Abaana bamaze okusoma, they can afford buying you a sack of sugar. Now musawo is telling you tonywa sukaali. Yeah, I understand the social support we need to give to these people. So continuously, we need to talk to these people why we should not take ABCD. The same way when you fall sick and you need someone besides you, and this is now chronic care. Okay. Then the medication, the dosages, most of them are elderly. They need someone to emphasize when to take medicine. They forget. Yes, because we talked about, no, we haven't talked about the risk factors, but one of the risk factors is age. So most of them are elderly. You find that these people, when they're aging, they have other things that came in, they forget, they get dementia. So they need someone to always talk to them when to take medication, how many pills to take a day.
Okay. So, thank you so much. What is the importance of sleep when we are taking care of this patient? Because I've seen so many people emphasize sleep. They must sleep. They must sleep. What's the importance of sleeping
Sleeping.
in
Thank
when we
you
are
so
looking
much.
out for these people? Yes, please.
Okay. So we always advise many, not only the hypertensive patients, everyone have enough sleep. The metabolic activities go on very well when we are at rest. We are taking a lot of pills. So we advise these patients to have enough sleep. And most especially the fact that our heart is the major cause of our heart is one of the organs that helps in the pumping of blood. And then we saw the high blood pressure is due to blood vessels, most especially the damaged blood vessels. Not all of them, but most especially the blood pressure is due to blood vessels. So we tell them to rest the heart. Not like the heart is not functioning, but it is not at work. When we are moving, we are doing vigorous exercises, you're shouting your ABCD, we are using it so much. But when you're at rest, you give it time to rest too. Thank you.
Okay. Masawa Solomon, again, talk about stress. I am the father at home. I've been diagnosed with hypertension, but I'm still the father. I'm stressed. What can you say about stress, and how can we help? How can we reduce the stress we put on hypertensive patients at home?
That is quite difficult. This is a father at home, has been diagnosed with hypertension and has to take care of his family.
Mm.
One of the causes of hypertension is stress.
Yes.
Yes. So when you're stressed, there is an enzyme that is released in our bodies. It's called
Mm.
adrenaline.
Mm.
This adrenaline constricts blood vessels
Mm.
and it raises blood pressure. So
Mm.
we need to talk to, that's why you talked about social support.
Mm.
And we always tell these patients, for example, you're a young man, you have
Mm.
children to take care of, you've been diagnosed with high blood pressure.
Mm.
Me as a health worker, we always tell them, do you have someone at home you can communicate to that can come to the hospital? We need to cancel both of you.
Mm.
You get it? So I will talk to the wife, is the breadwinner at home, has been
Mm.
diagnosed with high blood pressure. But the more stress you put on this person,
Mm.
it worsens the situation
Mm.
because stress raises high blood pressure. What we need to do is to cancel
Mm.
because this is something, stress is just personal. We just continuously need to talk to these people. As a
Mm.
wife at home, things that may stress this person, you dwell with them. If I've been
Mm.
a quarrelsome mother at home,
Mm.
everything irritates me. Now my husband has been diagnosed with high blood pressure. There are some limitations that I'm going to put.
Mm.
Okay, there are some things that I would do as a wife at home so that I
Mm.
don't stress my husband. The fact that has been diagnosed with high blood pressure. And on this same note, I always advise these patients to have the next of kin. Next of kin may not be my husband, maybe my sister, maybe my mother.
Mm.
Come with that person to the hospital. But most probably the person you're staying with at home.
Mm.
We cancel both of you. That day I will see you know you've not taken a meal, you're sleeping the whole day. I know what is the problem. I know
Mm.
how to talk to you.
Mm.
Yes.
So, in other words, what you're communicating is simple. That to the people that are living with people with hypertension or people with high blood pressure, we need to be considerate. We need to understand that these people are sick. We need to understand that these people need our support and help. Yes, he's the father. Yes, he's the mother. But we need to accept the fact that this guy heart and the blood vessels have a problem. And the more we stress this person, the more we worsen actually the condition. It calls for understanding partners and supporting families. That's why the issue of social support is really very important. Someone asked me, why is it that in the Western world, someone can be diagnosed with hypertension and they live with it for 80, 50, 60 years. But in Uganda, when you're told hypertension, you live for about 5 to 10 years and then you start to deteriorate. I think the difference is in the way, in acceptance and the support that we get. In
Exactly.
Uganda, we fail to understand supporting people that are going through certain health challenges. Someone is diagnosed with hypertension, high blood pressure, but you don't care. You don't care. Yeah, yeah. All you know, selfish interest first. Yes, he's the father. He has to give us school fees. You don't care. The guy comes home and explains, we can no longer afford the ABC because, the medication is expensive. I need to change your schools. And they're like, no, all my other bigger sisters or brothers went to good school. Why is it me? And then the wife, oh, you're my husband, you're supposed to provide. We must be understanding. And the successful stories that I've heard from couples that have been successful or whose partners are doing well on hypertensive drugs, one of the testimonies in how the other partner has been or is supportive towards uh, this hypertensive patient or person. If you have a wife that even reminds you to take medicine, chances are you're not going to miss your medicines on time. Chances are they are going to remind your medicine is getting empty. You need to get a refill or something like that. But if you're staying with people that don't care about, chances are you're going to miss medication. Chances are they are going to stress you because they are failed to accept what you're going through. And chances are that you're not going to get the effect that you're supposed to get on the drugs. So, bakyala baffe abalungi naddala. Njagala okubajjukiza that this man that you're stressing, that is hypertensive, has one heart. The heart is already sick. Don't be the other issue that is going to kill that man. Likewise, to the men, she is the mother of your kids, your children. She's your wife. Kitufu wamuwasa. Era the two of you became one. Yes, you became one, but you have two hearts. Now the other heart is sick. It needs some self-care, special self-care from you. As we try to conclude this episode.
Mr. Chimboa.
Yes, please.
Can I add on the person who asked the question concerning the Western world, why people live with hypertension for long?
Yes.
Besides the social support, the financial support,
yes,
these people are insured. Financial burden is lessened compared to a poor Ugandan who has to do investigations. And to tell you this thing is expensive. Someone has to do investigation, someone has to do an echo. It is quite expensive when you're meeting all those finances. So you find that this person in the long run has children, take care of the wife, the family, and they have to buy pills every month. That's why they die fast. And then some external forces. I have a family behind. They're also stressing me. There are a lot of things that are going on in our country. The politics alone. Even the politics alone, they are stressed. Now my opponent, my what, all these things, they stress these people.
And also supporting Manchester United. Oh, that is another.
That one I don't know.
That is another stressing thing. Okay. So I'm taking care of my father at home, and what are some of the signs that are and symptoms that I will see on this patient, and then see, oh, yes, we're on medication, but I think things are bad. I now need to go back to Rubaga Hospital. When should I bring back my wife? When should I bring back my mother, my father? What are some of the things I will say at home? And then I know, because yes, I'm on medication, I'm taking them, but things are deteriorating. What are some of the things that I'm supposed to look out for? And then I know I'm supposed to go back to hospital.
Thank you so much. As we talked on earlier on, these patients, now I'll give you an example in our hospital. We have the clinic days. Clinic days for chronic care, that is the hypertension and the diabetes. So whenever they come for that chronic care, we teach them. So every morning, we teach these patients what will you look for? What will show that this patient is deteriorating, that there is something worrying, I need to go back to the hospital. You get it? So that is another thing. As health workers, we should empower these people to be independent. They should be able to observe that possibly this patient, my sister is not well, my mother is not well. That is empowerment from the health workers. One of the things that we are going to see, if you are taking these machine readings, if this patient has a blood pressure machine at home, the interpretation of those readings. So we always, our blood pressures may not be the same according to our age. So someone who's 98 years, if that blood pressure is 150, it may not worry me so much. But if a young girl of 26 years, the blood pressure is 150, it worries me a lot. So when we are inducting medication, we have the standard. We always tell them to buy an exercise book. So we tell them if the blood pressure goes beyond this, please seek for assistance.
Okay.
And secondly, there are some other things. You find this patient might start complaining of chest pain, chest tightness. I feel a lot of pain in the chest. What might have caused that? Sometimes they will tell you syllaba. Musawo syllaba, nabadde syllaba ekiro. These are things that you should take note of. Sometimes they will start convulsing. Yeska, you don't need to consult anyone, your assistant, yours, always we tell, tubuzeeko jjajja alina pressure oba n'ebyali bimutuuseeko. We always tell them don't need to consult anyone. Please come to the hospital. At least when this patient is okay, you can go home. Rather than wasting a lot of time consulting other people who may give you false information. By the time you reach the hospital, this patient is in a stroke. Then the other thing we look for, failure to speak. You find that this person gets a minor stroke. It may not be vivid, that most people think stroke, you get paralyzed. Yes, you can get paralyzed, but there are those small things that come and we don't notice them. Or we don't pay attention, we ignore them. Somebody starts stammering. You find that you can look at me, but then the size of your mouth or the shape of your mouth, it changes. Nti gwatandika bwe gutyo omumwa ne gukyuka naye ne mutakifaako, you ignore it. It's a minor stroke, but then the chances are high that this patient is going to get another stroke again if it is not taken care of. So we always tell our patients, anything ky'obadde tolaba ku muntu ono ne kijja, it in the movement, ng'olaba atagalatagala, omukono guno gubadde asobola okugugira, agamba tasobola gukola ki, stretchinga. Agamba sayidi emu ey'omubiri tagiwulira. Let us not ignore such kind of things. Olumu bafuna ekizibu mu kussa, agamba omukka siguwulira. So let us not ignore such kind of complaints from our patients. We take it serious. Most especially ekisooka, chest pain, difficulty in breathing, movement, convulsion, severe headache. I'd forgotten this. This is one of the first thing we notice. Even young people, before you're diagnosed, obabuuza ki ekyakuleetedde okujja mu ddwaliro, musawo omutwe nga gunnuma nnyo. I don't know whether you ever heard about that, but one of the first things they talk about headache. And that's on the same note, I advise people to go for checkups, to do medical checkups. But what brings them to the hospital is headache. So that's the same thing as you asked me, biki by'olabirako, oli ajja kugamba omutwe gunnuma, namize panado naye omutwe gunnuma. Please go to the hospital. And Mr. Chimbo, on that same note, we should not ignore other things. Ekizibu kye tufuna nti omulwadde ono mulwadde wa pressure. So buli ekimuluma mulowooza ejja kuba pressure, omusujja gw'ensiri gye guli. Omulwadde ono ajja kufuna pneumonia, omulwadde ono ajja kufuna obulwadde bwonna obulala obuluma abantu. Naye abalwadde baffe buli ekijja oyo alina eddagala lye, mulwadde wa pressure abagamba omutwe gunnuma. It might be malaria. Okitegeera. So buli ekyagamba nti mpulira omutwe gunnuma tubatwale mu ddwaliro babakebere. Naffe abasawo omulwadde ono aza complaininga omutwe gunnuma for this period, namirako painkiller naye guganye. It may not necessarily be blood pressure. Blood pressure ejja kuba in the normal ranges. Can we do other investigations? Those other illnesses kill besides blood pressure. Thank you so much.
Thank you so much, Sao Solome, all the way from Lubaga Hospital. In a special way again, we thank Lubaga Hospital for taking care of our population for all that long. Lubaga Hospital gegamu ku malwaliro mu Uganda agatayisibwamu maaso for so long, agaludde nga galabirira abantu, especially in those chronic. Musawo, when is your outpatient day for hypertensive at Lubaga Hospital?
Okay, thank you so much. It is on Monday, Wednesday, and Thursday.
Okay, Monday, Wednesday, and Thursday. If you're anywhere in Kampala, please go to Lubaga Hospital and check. Do we have free checkups for this?
No, except when you're having outreaches. Still, we advertise about outreaches. Outreaches, we give free medication, free checkups. But when you come to a hospital, we pay some consultation fee, you get the checkups.
Okay. Okay, so there are some few questions that we are going to react to, and then we shall get out. Okay. This one is saying, thank you so much for watching with me today. Okay. Olivia is streaming live. Nakanoni Mori is saying, thank you for the program, Sao. Okay. Tabitha Caroline is saying, I think she was talking about some of the signs and symptoms that we can see. She's saying pain in the chest and headache. I think Musao has elaborated on that. Tabitha again is saying Musao nze waliwo bwebeebaka ne mpulira ng'omutima gunkubira mu magulu. Bannange, Tabitha, omutima ogwo njagala. What can you say about this? Omutima ogukubira mu magulu.
I may not understand that so well. Omutima ogukubira mu magulu.
Why?
I've not heard it before.
Nange ekyo siwulyanko. Tabitha, yonna gy'olivaayo tunyonyola omutima ogukubira mu magulu. But Tabitha, thank you so much for. Tabitha is my good friend and one of the people that have supported this channel ever since we started. Thank you so much. I'm going to start hosting some of these people to come and give us their experiences with hospitals in Uganda. Emboze ezabanyumira byebaagala amalwaliro gaffe gakyuseemu and things like that. Actually ataddeko aweza message naga nti gukubira mu magulu ne gukubira mu bigere. You've even made it worse. Okay. Again, she's saying Musao normal pressure ebeere inakuba etya. Tuddemuko tuwe ku bigere ebyo bya readings za normal pressure. N'omuntu omulala alina ekibuuzo kyo, you can put it here. We can have it before we call it a day. What are some of the normal readings era zina kubeera zitya?
Okay, thank you. So the normal readings ez'omuntu yenna omulamu, though we don't grade people, that we are not all the same. So omukyala w'olubuto pressure ejja kuba quite different nange atalina lubuto. Then ow'emyaka 9, what I regard to be normal or ku myaka 9 may be abnormal ku myaka excuse me, ku myaka 25.
Mm.
So I will tell you the normal reading. It is between 111,
Mm.
110 to
Mm.
129.
Mm.
That is the upper value.
Mm.
Then the lower value is between 60 to 89.
Okay. So Musawo, a quick one. Onaabuuza abaana b'e Dubai baba n'ebibuuzo. Again, Musawo, is it true that if I'm hypertensive, I'm not allowed to have uh, sexual activities?
No, it is not right.
Okay. So
Yeah.
Martin from Dubai, it's not right. Whoever told you that told you a lie. So as you conclude for the day, what could be your closing remarks to someone there that is taking care of a hypertensive patient?
Thank you so much. We need to appreciate these people so much. People who take care of chronic care patients. We love you so much. We appreciate you so much. And continuously do good to these patients. You are a strong pillar and you are the social support to this patient. You are one of the reasons as why these patients are alive. So we encourage you to continuously support these patients emotionally, financially, spiritually, and physically. And then the other thing, we encourage the young people to go for checkups, medical checkups.
Mm.
I may say that I'm not hypertensive at this
Mm.
time,
Mm.
but the earlier the better.
Mm.
So if I know my stand now, I know how to live the kind of lifestyle I'm
Mm.
supposed to live.
Mm.
I might be at a borderline of getting hypertension.
Mm.
So which kind of lifestyle am I supposed to live if I'm at the borderline?
Mm.
Yeah, thank you so much.
Thank you so much for that. And then also a simple one: how often should one check for high blood pressure?
A non-hypertensive patient,
Mm.
at least twice a year.
Okay.
Check your blood pressure at least twice a year.
Okay.
Yes.
So then lastly, is it true that if you start taking hypertensive drugs, you're supposed to take them for the rest of your life?
Exactly. This
Okay.
is chronic care.
Okay.
Chronic care meaning lifetime treatment. And one of the things Mr. Chimbo had not talked about,
Mm.
we've got misconceptions. You find that my pressure reading is normal today. I'm on
Mm.
treatment. I stop the treatment.
Mm.
Okay. The reason as to why it is normal, I'm on treatment. But when I
Mm.
stop treatment, the chances are high that it is going to go back. So we
Mm.
are supposed to take this medication for the rest of your life. But the difference goes to how, for example, if I'm taking 4 pills at the beginning when my blood pressure is high,
Mm.
when it stabilizes, it might go low.
Mm.
The number of pills might be reduced
Mm.
depending on my pressure readings and the prescriber's instructions.
Mm.
Yes.
Uh, Musao Solomon also uh, talk about alcohol. Someone is
Mr.
talk.
Chimbo, can you give me just a minute, please?
Yes,
Just a
please.
minute. I want
Yeah.
to first put my.
So, while she gets a minute away, I want to thank you for watching this program from wherever we started from, and I want to thank you for making it here today. The reason we have this program is simple. There are some things you hear here and to you know, and you think they are obvious. Everyone knows it. But I'm telling you, every day we are losing family members due to mistakes that we can stop. We are losing family members due to simple errors that we can eradicate. Someone is given medication, then they miss out on the right dosage and they die. Someone is given medication, then they mix it with herbal medicines, they die. Someone is given medication, then they take alcohol with the drug and it becomes poison and they die. So my role every Sunday morning is to continue to educate you, is to continue to enlighten you, is to continue inviting health professionals here to have a discussion with us. It may appear useless. It may not be that important to you, but I want to tell you, every single day in Uganda, in every small village, we are losing a patient. We are losing someone dying due to an illness or a disease that is preventable, that is manageable, but simply because this person did not have enough information. And that's the difference between our countries and those countries that we admire. We need to have a lot more of health promotion, a lot of public health education to empower our populations against preventable diseases. I always tell you that 75% of the diseases killing our people are preventable. There is no reason as to why in this era we still have children that are dying of diarrhea. There is no reason as in this era we are having people that are dying of non-communicable diseases, diabetes, high blood pressure, cancers, and all that, especially due to late detection or failure to make right decisions. Yes, Solomon, as we wind up, can you talk about alcohol and high blood pressure? Alcohol and smoking, you can combine both.
Okay. Thank you so much. Can you hear me?
Very well.
Good. That is something very crucial that you had missed out. Alcohol and tobacco use. Yeah, many people are not aware of this, and most especially the young generation concerning tobacco use. Why tobacco is not advised? It has an element, it has a substance in it that constricts blood vessels. As we looked previously, we talked about one of the causes of high blood pressure is constriction of these blood vessels. So tobacco has an element called nicotine in it. So this substance constricts blood vessels. That's why we advise young people and the elderly to do away with tobacco use. And then you've talked about alcohol use. Alcohol still has some elements. And one of the things we talked about, Mr. Chimbowa, the causes of high blood pressure is obesity. So alcohol has glucose in it, high levels of glucose. And glucose causes obesity. Obesity will lead to high blood pressure. So we advise people at least one bottle of alcohol a week, if you can, at least one bottle. Yeah, people drink because of different reasons, but
Yes.
at least one bottle of alcohol. But don't make it a habit that every day I must take alcohol.
You're,
Alcohol,
you're the very first considerate health worker I've ever hosted here that at least gives people at least one bottle. Now, the question is going to be, how big is that one bottle? There is a bottle I saw in Netherlands that has about 16 bottles of Ugandan size. So, yeah, but we get your point. Thank you so much for number one. accepting to come and share with us.
You're welcome.
To all the healthcare workers in Uganda, I always say thank you so much. You're the reason Uganda is growing at a faster rate. Forget the politicians, forget the economics, no. The reason the country is growing so fast is simply because of the dedication of its health workforce. And my point and call is always to all the policymakers, our leaders in all the arms of the government, please support healthcare budgets when they come to your committees. We still believe we can do better when it comes to funding. We want to appreciate the government of Uganda for the support that they're giving the healthcare, the millions, the billions. We know you're doing well and you're doing the best you can, but we still call that more money is allocated to healthcare systems, especially in these non-communicable diseases. They are silent killers. Yes, we are doing well when it comes to HIV, malaria, and those communicable diseases, but these silent killers, the NCDs, are killing a bigger number of people silently every single day. So we still advocate for more funding to international donors, to non-government organizations. Please inject more money in healthcare system to empower the health workers do what they can do. It's always sad that you see private hospitals where thousands of people go, that some of these conditions, people still have to pay for them to get care. Inject money in these private, form public-private partnership with these private hospitals such that people can go to Lubaga, which is a private entity, but acquire free services for these non-communicable diseases. Because at the end of the day, if we don't create easy, or if we don't make these affordable, we are going to lose people who cannot go to some government facilities for one reason or the other due to these diseases. And then lastly, someone is saying, Musao, osobola okufuna pressure. Nsobola okufuna pressure nga sibadde nayo nga ndi lubuto, naye nga mmaze okuzaala, era naye ebeera pressure efuuse chronic, nga nina okuba ku ddagala paka kubanza omusawo yali nzijjako.
Yeah, thank you so much, Karen. You're very right. Kati abalina embuto, sometimes pressure goes high because of pregnancy. For that case, it is okay. It is not a chronic illness. It came because it was precipitated by pregnancy. So musawo okuggyako eddagala eryo after monitoring you. Excuse me. It's not a mandate that when you deliver, it will go high. There are some people who have kept on, whose pressures have kept on going high after delivery. It started during pregnancy, and she's now an hypertensive patient on chronic care. So I advise after delivery, please make sure you monitor that pressure for about 6 months. And go back to your health worker. That's when the health worker can decide either to stop the medication or to continue with it. Thank you.
Okay, again, Musao, you're having a brother here sending you greetings. Okay, as we conclude, there is something important that I actually missed. What are some of in like a minute or two, what are some of the things that actually can cause high blood pressure as we conclude? That's my last question to you. I know you want to go to church. What are some of the things that can give us high blood pressure?
Just a moment, please. So, one of
yes,
we
please.
talked about age.
Age, yes.
Actually, the cause of high blood pressure is not known. But these are just risk factors.
Okay.
Risk factors are just behaviors that can precipitate what we think have chances of causing high blood pressure. But the cause of high blood pressure is idiopathic. So one of the things is age. As we grow old, the chances are high that we are likely to have high blood pressure.
Yes.
Then we talked about race. As
Yes.
someone asked that in European countries, so high blood pressure is so much in blacks. I don't know
Yep.
why.
Yep.
And whites get it late, quite late, but it sets in early in blacks. That is something that we shall talk about next time.
Yeah.
Yes. Then we talk about our exercises. We talked about exercises prior. So if you are living, how do we call it? If you are living a lifestyle, a dormant lifestyle, we don't exercise, we eat, sleep. The chances of having blood pressure is high because the food we eat, it just logs in our body. We become obese, and then the weight places the blood vessels. Then we talk about age. Then some drugs we take, as we
Yep.
talked about, alcohol consumption, tobacco can also lead to high blood pressure. Okay.
Musao, you talked about drugs. Can you in a minute talk about family planning and pressure? Can hypertensives use family planning? I forgot that question someone sent me actually when I was planning for this show. Just in a minute, yes.
Thank you. There are some types of family planning that raise blood pressure.
Yeah.
Yes, and that's why when you're planning to have that family planning method, you go to a health worker, they check your blood pressure not once, not twice, and then that's why they have to induct you
Naye babiwulira
on the family
abakyala
planning method.
abakyala baffe bagenda ofuna family planning ne boda bagireko etokota oba okyabannyonnyola what is bet for them nga bafulumyedde eddwaliro. Musawo Solome, can you send tumira ku bantu bo and then we close off the show for today.
Yes, yeah. Before I talk about, I said the last word. There's something family.
Yeah.
Some blood pressures are in the family.
Oh,
You can't outlook that.
okay.
If my mother is hypertensive, I stand a chance of having my children, or either me or my children, being hypertensive. So it is hereditary. The chances are high that I might get this high blood pressure from my parents. Yes. So I want to appreciate you so much, Mr. Chimbua, for the great opportunity you've given to me to speak to the nation concerning high blood pressure. I send my big regards to my family members, to my workmates, and to the world at large. Thank you so much.
Thank you so much, Solome, for accepting to be with us. Again, high blood pressure remains a silent killer among Ugandans and Africans at large. If not detected or if not managed in time. My call and request is simple to everyone listening to this video. Please test at least twice a year, like Shah said. Most of these things come slowly, but over time, they become chronic. We can save actually a lot of money by having early checkouts. Some checkouts are free in some places. Some they pay little money, like 5,000, to have this checked. But if checked in time, you can save yourself lots of money or lots of issues that may come with late detection. I want to thank colleagues in the health sector that continuously educate the masses. We are going to have another episode on high blood pressure. Today's episode was how to take care of hypertensive patients at home. Next time, we are going to have a consultant on hypertension to take us more on medication, why, when do we change drugs, and why, and which category of people should be worried. I want to thank you for watching. But if you're watching me up to this time and you've not yet subscribed, I kindly ask you to subscribe to this channel and to keep in touch every Sunday morning at 7 a.m. when we host different healthcare experts. Again, our role is to speak about healthcare. Yours is to take a decision. You can decide if you want to die today or tomorrow. You can decide if you want to live a healthy life or the opposite of that. The decision is in what you eat, what you drink, how you sleep, for how long you sleep, and if you do exercises or not. A health man says 3 things are going to determine your length of life: how and for how long you sleep, when and what you eat, what the exercises you do, and then the environment in which you choose to stay in. I want to thank all my partners and sponsors for making this possible, especially EDSA Foundation, that financially sponsor these shows every Sunday morning, and the rest of the partners that sponsor in so many other ways. May God bless you and have a blessed Sunday. See you next Sunday when we host another guest or another expert to talk about another topic that will be decided. May God bless you. See you. Bye.